Assalamualaikum. Good morning to everyone. Today's important topic that is, and it is common and always asked to the bed case. You know, there is two cases here. It's important. One is perineal tear, that is complete perineal tear usually given. Another is fistula. You heard the name, the fecal fistula and vesico-vaginal fistula. So today class is so important. You should attentively be here and give attention more. Okay. So that is at first I want to talk about what is injury. Injury is common key accident and injury. Latest there is a maternal injury. You heard the name. Then this tishal there is a tract injury and baby born by the rupture. So, what a miracle and what a pathetic also. So, injury at any time may happen. Injury in different form, that is abrasion, and what is different forms of injury there is. Laceration, ecchymosis, then what are the other form injury? Cut injury, there may be cut also. Okay. So today that is what is important, that is burn. You know what the burn of the vulva vagina by what? By chemical burn, by using some chemicals, and also there is some foreign body impacted in the vagina, forgotten some tampon like this, and there is also injury by the intrauterine contraceptive device. Maybe there may be also. And another is how deficient perineum is formed. During vaginal delivery, there is injury to the vulva and vagina perineum. There may be. And when there is injury to the perineum, there is the different types of the perineal injury. Perineal, there is first degree, second degree, and third degree. And ultimately third degree, and there is also fourth degree. So, first degree perineal tear is only skin and some other tissue, part of the some superficial muscles. And skin and muscles is second degree, and third degree is sphincter, and fourth degree is anal rectal mucosa. Okay. So, these are the trauma to the female genital tract, and ultimately the complete perineal tear. Laceration is common in the cervix after delivery. You heard the name, that is cervical tear. One of the common problem in obstetrics, more bleeding. Ultimately, there is a patient undergoes shock, even death may occur. As lateral part of the cervix, there is a descendant cervical artery. If it is ruptured, then bleeding is torrential, like opening of the tap. As vessel is open, so bleeding likes opening of the tap. Okay, you understand? So, and fistula, how fistula is formed? That is, what is definition of the fistula? I think all of us know. So, urogenital and the fecal fistula. Here you see that the organ, just I mentioned here, fistula, how it is formed here. You know this, and this is pubic bone. This is, what is this? Bladder, uterus, vagina, okay, and rectum. So, the urogenital fistula is formed in between urinary bladder, urethra, even on ureter, with the uterine wall or cervix or vagina. But most common is vesico-vaginal fistula. Most common is vesico-vaginal fistula. And how it is formed? Vesico-vaginal fistula is common following obstructed labor. Okay? In obstructed labor, I can show you this. In different site, the fistula may be formed. Common is at the level of the pelvic tree. and mid-pelvic also, and also below this. If the during obstructed labor, suppose like this bowel presentation, in front is bladder. Imagine this is bladder. Huh? Bladder in front, and bladder is in front, and this fetal head is behind. So there are two bony parts. Okay. So this is bony part and this is bony part. In between there is bladder. So if a long time of obstruction, more than 3 hours, then there is compression in the bladder wall. Is it not possible or not? It is. If there is obstructed labor, no progress of labor, then compression of the bladder in between fetal head and bony pelvis. So there is ischemia, necrosis, and sloughing out of the tissue. So in this way there is formation of the vesicovaginal fistula. Okay. So it may be in this level, it may be in the mid vagina, or in the low vagina, or high vaginal level. Huh? It depends upon the site of the obstruction. Okay, and shape also depends upon the trauma. That is how much part tissue is injured. 2 cm, 2 to 4 cm, and more than 4 cm. Mild is 2 cm, less 2 to 4 cm moderate size, and more than 4 cm is larger size. Okay. Now, and how other way the fistula is formed? What are the other way? Any other way of sitting? You can say during surgery. During surgery, there may be also trauma to the bladder. Suppose obstetric labor, you open up during cesarean section, you cut the bladder. And also extension to the vagina like this, so there is the formation of the fistula. And during hysterectomy also there is injury to the uterine formation of the fistula. And there is infection, some chronic infection like granulomatous diseases, sarcoidosis, may cause the fistula. And carcinoma, cervix, in advanced stage may cause fistula. Radiation may cause fistula. So these are the causes of the fistula. Okay. Now, if we say here, it is name of the fistula now. If bladder and vaginal fistula, their communication, then it is named vesicovaginal fistula. If with the uterus, then what is the name? Uterus from the bladder. So, uterovesical fistula. If along with the ureter, with the vagina, ureterovaginal fistula. So along side, sometimes there is ureterovaginal fistula also. If with the urethra and vaginal wall, so there is ureterovaginal fistula. So according to the site of the affected area, there is name. So vesicovaginal fistula, and what is uterovesical fistula, and ureter, the ureterovesical fistula, and there is also ureterovaginal fistula. Okay, you understand the name, na? Affected area. It is somehow hard topics, okay, but you can just highlight in this way. And if you think the fecal fistula, sometimes there is superineal tear and rectovaginal fistula. Rectum communicated sometimes long, that is short, long, occipito-posterior, long time, and it may cause sometimes rectovaginal fistula, obstructed labor posteriorly. So there is rectovaginal fistula, that is low variety and high variety. Okay, these are fecal fistula. Now, how you diagnose this fistula? Can we diagnose the fistula from history, from examination? Okay? From history, how can we diagnose the fistula? And how can we prevent also? How can we diagnose and how can we prevent? Okay, so regarding fistula and regarding complete perineal tear. At first I told you the complete perineal tear. If tear, what is that? There are some organ is mainly the which organ affected? Perineum, pelvic floor disorder. Pelvic floor disorder. Pelvic floor disorder means perineum and liver function disorder. If there is disorder of the perineum and liver muscle, that is pelvic floor, so many problems. Incontinence, then vaginismus, then flatus. That is flatus. He cannot sometimes that is incontinence of the flatus, incontinence of the fecal materials. So she cannot hold the flatus, she cannot hold the fecal materials because there is defecation reflex. Suddenly, especially when suffering from loose motion, then there is, she cannot control the defecation. Soil of the cloth, and this is a social problem, personal problem, family problem. And sometimes after the other, sometimes these are associated with psychological stress, psychological problem, amenorrhea and lower abdominal pain, and food drops, like this. So many complications also associated. So most important is inability to control the flatus and defecation reflex. Okay, that is more important. And pain in the perineum always, and sexual problem, and vulvodynia, that is always pain like this in the vulva. Okay.